Thank you all for tuning into the Innovator's Playbook podcast. I'm your host, Seth Narayanan, founder and CEO of Telliant Systems. I'm really excited to introduce Steven Meyer, CIO at New York Ophthalmology and a leading expert in healthcare technology and consulting. With extensive experience in IT, security, and practice management, Steven guides physicians and organizations in launching and optimizing independent practices. He's passionate about transforming healthcare through custom software solutions and AI driven insights, bridging data into actionable intelligence. Steven's hands on consulting and innovative approach have empowered countless practitioners to thrive outside large conglomerates. Today, he shares his journey and vision for the future of healthcare innovation. So, Steven, thank you for coming on and talking to us here at the Innovators Playbook podcast.
Thanks so much for having me, Seth. I really appreciate it.
Wonderful. So, let's dive in and give the audience a little bit of background about you and your career path. You've held a variety of roles in technology, in operations, and in infrastructure management over the years. Can you provide some kind of insights and background on how you got started and what led you to your current role at New York Ophthalmology?
Sure. I started out, I guess, for spare money. A lot of people would do newspapers and things like that. And I realized I was good at fixing
Your
computers.
paper route.
Yeah, it all started with that and it gradually became a career. So I first got pretty serious about it working for a hospitality group where I got involved with open source phone systems and large scale networking. I also worked with a couple of installed audio slash network companies to learn the physical aspects of it, not just the programmatic ones. And then as time continued, I started getting more involved with MSP type work, people who would outsource their IT needs. And from there, it continued onward to more phone work, more large scale network work, and still doing a fair amount of consulting until I started getting into the healthcare space through a friend of a mutual friend. And I started with them just doing the basic security, networking, installed audio. Basically, they opened up a new office and I set up the new office. But him and I grooved really well. And next thing I know, I was a little bit more involved in the operational aspect of it, the day to day and kind of automations. And this is well before AI, but we were always looking for ways to do more with less. And that stands from a staff perspective as well as a effort perspective, right? You really want to be as lazy as you can possibly be to make the same amount of money. The more you could automate and watch
Yeah.
the ball bounce, the better off you are. And from there, it was word of mouth. And I started picking up healthcare clients all over. I've done stuff as far south as Georgia, doing a fair amount of consulting that way. But I absolutely love healthcare. It's a never ending river of problems and obstacles that you have to get over and jump through.
Yeah, you nailed it. I think healthcare and technology are two important pillars of our society or of our business, and you're kind of involved in both. EHRs and practice management software is a big need on the healthcare side with a lot of these providers and so on. And you kind of manage that for New York Ophthalmology and a bunch of other clients. So, what are some of the challenges? Just maybe drill down a little deeper in the healthcare technology space, including EHRs and practice management systems that you run into.
One of the things that's fresh in my mind right now is you go around, there's a couple of big players, but there are hundreds of EHRs and PMs, and you're always looking, what do I have the budget for versus what's going to give me the least amount of problems versus what is everybody else around me using? And I've really been focused in a lot lately on image management and third party API access. With the EHRs, there's always the challenge of, okay, I have equipment. Is it new equipment? Is it used equipment? Can it send images to my EHR? How does the text reminders work? Is there two-way
Mhm.
patient conversations going on? Is the scheduling blocking sufficient for what I need? How
Mm.
does it affect my office flow? You need to listen to what they have, and then you need to forget about all of it and watch what somebody who already has them is doing and say, okay, how could I improve upon that? So
Mm.
choosing EHRs and PMs is often a fairly complex process. And I think the important thing to take away is your way of doing things is going to be different than the next person's, and nobody's is going to be perfect. But you want to get as close as possible while maintaining your budgetary constraints and your headache constraints.
And you mentioned a few things there: image management, scheduling, communication. Those are all very important aspects of any platform that a provider or a practice uses. And as you mentioned, there is a lot of fragmentation, right? So some EHRs and PMs support some functionalities, some don't, and then mapping that to what a provider is actually looking for to provide seamless service to their patients, then you end up having to figure out what pieces are we going to stick together and how are they going to work with each other to provide a seamless solution to the customer or to the patient.
One of my personal pet peeves is the way I see it. To me, one of the big problems in this space right now is everybody has their own distinct solution, and it's a very closed garden of kind of what they're willing to work with and what they're willing to provide. Where it used to be you have marketplaces and you say, "Oh, I want this company's patient communication. I love this company's reporting backend." In other fields, you can do that. So, what do I see in EHR and a PMS? I see it as a database. I really want it to be the best possible database it can be. So
Mm.
I want the core functionality built out so that I can have other software that can fit my needs that can work with it. Too many times they're trying to be everything. Well, just be some things really good and then let other people work on those other modules. It's way too much of a giant ecosystem that they're trying to build around their software. So you say, oh, this AI tool, this dictation tool, this whatever looks great. So therefore, I want it working with my system. And they say, we support this for it, but not that, or this is going to cost you X amount to integrate this, and we have only this part of the functionality, or the answer is flat out no.
Yeah.
And I
Yeah.
really think that's yesteryear's thinking. I think these companies, if they really want to move forward, have to be a database that is open, and then you put the insurance and the responsibility onus on those companies that interact with you.
Yeah. You bring up such a important point. I remember back in early 2011 or 12 when I went to my first conference, the HIMSS conference. That was the buzzword back then, was interoperability, right? So everybody kept talking about how everything is going to move towards being interoperable. But here we are 11, 12, 13 years later.
It didn't happen.
Exactly. It's become a buzzword and they talk about fire, there's HL7. So they kind of show you a little here and hide a little here. And it's not quite somebody like you that wants to dive into the data that's out there and build hooks and reports and transfer of data that you want to do. You want to do it, but you can't because they don't share everything with you and it's very limited.
You brought
Yeah.
up such an excellent point, which is
Yeah.
HL7 and DICOM. If you have something that is beyond just slices, an image, right?
Mhm.
How do you view it within your EHR? You simply
Yeah.
can't. You're
They
screwed.
can't.
So it's okay, I want a work list and I want these images. But then at the end of the day, you're still having to go to the machine to view.
Yeah.
It's a nightmare. And nobody's willing to get on the same page as to what they're willing to accept and what they're willing to work with. Really, there's a huge update that needs to be done. And I'm not saying it's broken. I'm just saying we have progressed beyond
Mm.
what that standard was really built for in
Yeah.
terms of the interoperability and the imaging.
Yeah. Exactly right. I've been to the RSNA conference several years, and that's where all the big imaging players are, and they're kind of in their own silos. There is a lot of innovation happening. But again, as a patient, I'm just putting on my patient hat here, and I go to 3, 4, 5 different specialists, and that data is all. I wish I could have access to that data in a form that I can manipulate and do things with, but it's still not there. You and I can talk about the lack of interoperability for the rest of this show, but maybe let's tackle a next topic here. I'm going to ask it in a different way. I'm going to talk about AI and what it's going to do in healthcare and what the possibilities are. But are we going to be hampered by the same siloed data that stays in its own little bubble from making effective use of AI in newer technologies? For AI to be truly productive, you need to have lots of data and the right amount of data, right? So are we going to run into issues? Because for me, as a patient, I have my GP, and let's say if I go to my endocrinologist or if I go to my ophthalmologist for my eye, they don't really see the data between these three places. But how are you going to create effective models and effective solutions if AI models don't see all that data across practices, across specialties, and even across patients? Answer the way or part of it that makes sense to you.
I want to dissect it a little bit.
Okay.
Let's first talk about AI integration, right? Because that's really the blossom of the flower that's going to happen in the coming years. So this kind of goes back to interoperability, meaning some people are developing a closed system AI within their software.
Yeah.
And AI right now, they're using it because of where it's at for mostly for notes and for billing purposes, meaning generating
Yeah.
your notes, generating your billing codes, things of that nature, which is great. However, it's not great if you can't use a third party, going back to interoperability and database. Let's put that aside because really dictation has been around for years. And a lot of doctors I know speak their notes into an iPad or computer as it sits today. So we have that, and it's trying to solve baby problem that, yeah, it takes up some time, but I'm not totally convinced it's going to get rid of scribes and things like that, at least not in its current form, right? You still need somebody to pull up the images, and there's a good idea there, but we're not where we need to be the first ones to say we have AI. That doesn't mean it's a good implementation or of AI or even a remotely good use of AI.
Yeah.
So then let's talk about going up here. Next thing you said is between doctors, in order to give yourself a complete view as a patient of your health and model how you're doing health wise.
Like the vertical integration of data, right?
Yes, you say that, right? And in your head, you're like, oh, that would be so nice. And in my head, all I could think about is, oh my God, the security nightmare of doing that. I think HIPAA needs to be revised.
Right.
Nobody really has a great clue as to what specifics HIPAA really entails. Like, for instance, the PCI standard is very clear for credit card processing.
Yep.
HIPAA is much less, and it's certainly not built for AI. Yeah, data at rest needs to be encrypted. There needs to be authentication. Nobody would build a website that's not encrypted. Nobody would not have authentication or multiple way two-factor authentication. I think because HIPAA as a standard isn't there yet, security and interoperability isn't there yet. I think that's so far out. I'm not even worried about that in the next 5 or 10 years. I am curious about, which you hinted on, is how can AI help you with your large amounts of data in the practice? And nobody's really looking this way yet, right? But what is the data really telling you? If you are a solo provider or a small provider, or even a larger provider, right? You own a practice, you want to know how your practice is doing and what the red flags are, what you're doing well, and where to go from here. AI can actually do that somewhat well today and will only be getting better and better. And why we're not focusing on that and we're focusing on things like dictation is beyond me, really beyond me, because there's so much data here. And how do you know if you're seeing a patient too often? you're in a large volume practice, right? You're doing follow-ups, you're trying to market yourself and everything else like that. How do you know that you're not doing OCTs too often or not doing visual fields too often? How do you know that care is being administered effectively? How do you know that you're billing effectively, that you're not billing too much of one code or not enough of a code? How do you know that your volume is changing? Now, yes, you can check by manually running reports until your fingers bleed and figure these things out. Essentially, what's going to become a conversational AI tell you what's going on in your practice and what you need to be aware of. Hey, new patients from this referring provider has dropped. How about you swing by and check in with them and see what's going on? Or, hey, I've noticed new patient providers are stagnant. Why don't you set up a marketing day? Hey, I've noticed this code is being overused. Consider doing this before you get audited. These are really what's more important to a practice than dictation.
No, you're absolutely right. Dictation has been around in some form or the other for a long time now, right?
Yes.
But I guess the next step to that is automated coding based on the scribing and maybe automated billing. All that, again, seems to me like maybe the low end or the low hanging fruit value that you would get out of a automated and AI driven system. But what you are talking about is building in intelligence, like we talk about agentic AI, and if a CFO of a large practice is daily looking at the various dashboards and stats and numbers and sensing a pattern or sensing problems, you're thinking AI could be doing that, right? It's constantly looking at these dashboards, kind of almost like a automated CFO. Same thing on the security front. Somebody like a cybersecurity czar of a company is looking at what are my threats and what are my weak points and monitoring it on a automated basis with the data that it's ingesting.
And we say CFO, but how many practices out there have CFOs and don't just have an outsourced biller? Maybe they're in this country, maybe not. Maybe they know what they're doing, maybe they don't. And they're just at the mercy of that. And we're right now we're talking purely financial, but we're also talking your volume, your
Marketing,
coding,
sales, like
your diagnosis, your patient. Are your patients improving? On average, is visual acuity for patients going up or declining? Are treatments being done on a proper level? Are you getting reimbursed for things that you used to be getting reimbursed for? Yes, I would love to say a good CFO or a good head clinician or whatever, it would be great at spotting these. We're human. That's why we suck at spotting these things.
yeah, you're right. Especially like when you start blurring over the data, computers do a much better job of tracking numbers and keeping score. You mentioned a couple of times about the security challenges here, right? Let's look into that. You managed a lot of practices and you probably run into encounters with the incidents involving vulnerabilities in a lot of different areas. So, is AI the answer, or how do you prioritize cybersecurity, especially in smaller practices, maybe even larger practices?
I think there's two ways to look at security, right? There's patient identity security, meaning patient data security,
Yep.
and then there's network security. So, for instance, small in a hospital, right? They are mandated to do certain things. They're mandated to have certain ways of authenticating, certain password policies, being able to restrict IP addresses, all these things that small practices simply don't have the ability to do. And IT services will come along and they'll say, hey, we'll install Active Directory and you'll use a Microsoft login and it will be secure because we have an EHR and this, that, and the third. It's not really how it works, especially if you look at the way that most of these breaches are happening. First off, I wouldn't want on site anything anymore. I much prefer the insurance responsibility and the onus for security and SOC compliance, HIPAA compliance gets pushed onto whatever cloud provider you're using. So
Yep.
I'll say that first off. Second is people saving stuff locally to the desktop irks
Mm.
me. And even organizations with huge amounts of Google files or Teams files or whatever, people download it to their personal stuff to review it at night. This
Yeah.
is our job. Sometimes stuff needs to be done, and sometimes data gets moved that theoretically shouldn't be moved.
Yeah.
And the fact is that putting in those types of implementations that prevent that can be very impractical for small businesses. I think a lot of times when we say security, we're worried about the wrong stuff. For instance, somebody hacking your router. Well, yeah, it's a good idea to have logs on your router. It's a good idea to make sure your passwords are good, that yeah, you
Uh-huh.
use Proofpoint or something else in order to reduce network intrusion. But most of the time it's social engineering, right? It's emails. Somebody calls in and they're like, they realize what an email is, and then they're able to either do a SIM card swap or a SIM card attack or some sort of two factor. This is why anything to make it more difficult for somebody who is not in your location is better. If your EHR allows you to only log in from your IP address in your office, do it. Why not?
Yeah.
It makes it safer. The less remoting stuff, RDP, the better. There's so many new types of network overlays like Tailscale and things like that out there. I guess in summary, the kind of idea that I'm going for here is it's really a best effort, but the best effort you could do is really training your employees not to be silly with work computers and to watch what emails they open more so than investing in high technology on your thing. Yeah, get an EDR antivirus and maybe get Huntress or again Proofpoint. But beyond that, if your
Mm.
stuff is in the cloud, just try not to download patient information locally and you'll be much more secure and not have to worry about that as much.
Yeah. And don't click on things that look.
Suspicious,
Yeah.
yeah. Because they have this thought of a hacker breaching your firewall. And nowadays, that's the most brute force way to go about it. If I call you and I say, hey, I'm from Epic
Yeah.
and I noticed the problem with your login, can you confirm blah, blah, blah? The next thing I know, I have your full Epic login. That's much more common.
Yeah, no, absolutely. I think the big cyber attacks don't happen against small practices. They are probably going for all the records from Equifax or from Wells Fargo or something like that, and not small practice. What they want is you to do is click on an email that looks like that came from maybe Microsoft, and hey, reset your password. Your password are expired.
100%. Or just leaving backdoors open into your network like RDP. Again, we spoke offline about a couple of years ago, Exchange servers were being hacked through RDP. Anybody who used remote desktop, there was a flaw in
Mhm.
remote desktop where
Mhm.
you could bypass security and then upload crypto ransomware. The less of that, the better. So keep
Yeah.
it simple and watch what you do, meaning train your employees. Hey, think about it. Am I really going to send you an email without talking to you to wire money to someone or to send all these files to an email you've never seen in your entire life?
Yeah.
And turn on two factor. All right, I'm done.
Although I have a personal item there, this two-factor authentication. I like this authenticator app that Microsoft has, but I remember back in the day we used to get the RSA fob keys.
Yes.
And I don't know, I feel like these days with the mobile app, I haven't seen very simple, easy to use two-factor authentication being used. Even the one with Microsoft is, I feel like, convoluted.
Sure.
Yeah.
So I'll give a suggestion for that. First off, when it comes to two factor, you and I are pretty much talking about where you type in a PIN. Sometimes
Right.
it gets texted to you. Sometimes you have to use an authentication app. We're not going as far to talk about FIDO devices and stuff like that because there's almost zero implementation for it for
Mm.
the small or everyday practice. That's hospital level stuff for the most part. And EHRs and PMs don't really care too much about that. I personally, for all of my stuff, I use a program called Authy, AUTHY, is owned by Twilio, I believe.
Okay.
And the reason I love it is it's very clean and easy to use, and you could have it on more than one device. So if you
Okay.
lose your
I'll have to look
phone,
into that.
you don't
Yeah.
lose all of your two-factor authentication. You could
Right.
also pull it encrypted from them. That's why I like it. I prefer that for storing those passwords.
Good point. Yeah, I'll remember that and look into that. I'm looking for something simple, to be honest. You touched on KPIs and accountability in healthcare practices on how that data is really not being tracked, how the practices are performing, and you can pull reports and do it. Maybe expand on a little bit more on how you can see new technologies bridge that gap.
Taking a look at information and spitting statistics out to you isn't very helpful. But if it creates a set of KPIs and holds you accountable for it, it becomes very helpful. When you're running your practice, you have little to no time to come up with KPIs and proper accountability in each of the areas within your practice, right? So, what your KPI is for your marketing team is 2 more new referrers a week or a month. And that's really not a proper KPI because KPIs are supposed to be about performance, not just milestones. And I really prefer that when we onboard a new marketing person, I create a spreadsheet of what I want them to do and then how many places they visited and what the notes were. CRMs have existed for years. We've all used them and they all have charts that we could get a glimpse at what's going on. But where is the actual accountability and kind of oversight for hitting those
Mm.
metrics and assigning those metrics?
And you also mentioned earlier about what can be done to improve it, right? So let's say your KPIs is X visits per patient, but you're not measuring up to it. But then looking at the data, can it recommend here are 5 things you're not doing correctly, right?
Yeah, I play with AI a fair amount. And one of the things I had to do was I export from our database in the best way possible because it's a nightmare, as we spoke about.
Yeah.
I exported our referring providers and our patient counts from them over time. And then I had AI process it. And I said, give me a list of people to visit, create a schedule for my marketer of who to visit and what to do with them in order to increase new patients. And then AI did its thing and it gave me a breakdown. And then it said, would you like me to take a look at which ones generate the most value for me? And I was like, I didn't even think about that. Of course I do. Who cares if they send 50 patients if they're all patients? Removing foreign objects from an eye is great, but somebody who needs cataract surgery is a lot more valuable for me.
Yeah.
It's really stuff like that. Those data sets are too big for a human to accurately go through and extract that data without their fingers bleeding. And that's where I want to see AI pushing into not only just the KPIs and accountability, but what to do about it. Come up with a plan for me and explain to me why that plan makes sense. Help me be a better business person from a data standpoint.
Yeah, we could probably talk all day about the issues and challenges with data extraction and how we can manage it in the EHR PM world. But I'm hoping that this whole interoperability thing is eventually solved by some kind of fiat or not. In fact, last year when I was on HIM, somebody was talking about tougher regulations being implemented to force EHR providers to share data. So hope that comes to pass. Let's change gears a little bit. You've been in senior and leadership roles. What do you believe are some of your personal tips for being successful?
A leader within your industry?
Yeah, also within organization and maybe teams that you're managing, leading,
Got it.
essential leadership lessons that you've learned. What works?
Here's the thing. I think this depends a lot on your team, but the way I like to build and create teams is I want people with not just the ideas, but who are willing to put in work. And then I see when I am their, let's say, supervisor, I want to empower my people to do their job as best they can. It's a little bit guiding, but a lot of it is how can I make your job better so that you can do a better job? So I think one of the most overlooked things about leadership is empowering the people beneath you to grow as an individual and as a worker and allow them to fulfill the role that you need them to fulfill. You need to give them the opportunity and knowledge and the insights to understand. One of the things that like really hurts me throughout my life is you'll be working for somebody and they'll ask you to do something and you're like, okay, why are we doing this? Don't really understand what our goal is here. I never do well in those positions because I never know what they want the end game to be, what the
You
bigger
need that.
picture is.
You need the buy-in from your team, understand the vision, and then buy into it and make it cause, yeah, instead of it being, hey, we're going to sail to Mars and hold on to your sails and here we go. Instead, you almost let them pick the direction, right? You're like, hey, maybe give them we want the practice to grow 3x in the next 5 years.
And as you said, you really need people to understand that bigger picture and buy in. And they need to know what they're buying into. Here's the thing, and this is a consequence of that. If people feel that they are on a tight team where everybody's working for the same goal, they are more likely to stay. They are more likely to work at a higher level. They are more likely to run with ideas without being prompted.
Yep.
Teamwork is everything, making you feel like you're part of a family, that your voice matters. It's crucial. Now, with that, though, you got to get rid of people who are toxic. You got to get rid of those people. If they can't or won't pull their weight and you don't have a place for an employee like that, because there are jobs where this is a mind numbing job you could do, that's fine, no problem. But those aren't people you could retain.
Yeah.
I guess you could throw like huge amounts of money at it, but that's not good. It's not good
Yeah.
for your business. You want people to be bought in on your objective, on the service you give, on the quality of care, on the goals of the business. That's how you lead, is making everybody feel like they are growing as individuals and growing the company that they are a part of.
I think that is the key for effective collaboration and innovation. Innovation doesn't happen when there is no buy-in, right? When there is no understanding of the big picture, understanding of the vision, understanding of the direction, and then the freedom to innovate and problem solve, right?
Yes. I love it when you work with an employee and over the years, they keep getting better positions and you keep having one-on-ones with them and talking with them. Every time they move up, you go through with them kind of what the issues are and where it could use some help and get their thoughts on it. Seeing those people rise to the occasion, that's just the best feeling. I love that.
Yeah, no. So finally, I ask this of all my guests. What is your advice to future children, kids, young adults who are coming through schools and colleges and getting into technology? What is your advice for future, let's call them innovators?
Put in the work.
And you know that 10,000 hour, I don't remember who said it. If you want to be an expert in something, you got to put 10,000 hours in it.
Yep.
Yeah, whether it's being a musician, not a soccer player or whatever.
You got to hustle. If you want to make something of what you're doing or get into a field, you're going to do a lot of stuff for free. You're going to make a lot of mistakes. You're going to wind up working a lot of weekends. You're going to wind up spending a lot of time you will never get back doing stuff that you'll never understood why you did it. But at the same time, those are the things that kind of build you. When we would say back in the day, okay, Microsoft is coming out with a new blankety blank. Okay, get it, download it on your home computer, mess around with it. That way you have an idea what's going on. We have so many beautiful resources nowadays that didn't exist. And I love instructionals, but you can only get so far by just looking at somebody else do it.
Yeah.
You got to do it. You're investing in yourself every time you do that. I would also say there's no real excuse to not do something anymore. And let me clarify that. It used to be like, okay, I want to do this project on the side, right? Because if you're in technology, you always have
Mhm.
something going on as a little side project or whatever. But hey, I don't know how to do this, or hey, I don't know how to do that. We have AI now, we have
Right.
YouTube. There's no excuse for it. You could buy a subscription to Cursor or one of the other keys for $20 a month.
Yeah.
There's no reason that you can't do something, even if it's like, I know I don't want to learn how to write Go. Okay,
Mhm.
great.
Mhm.
Don't learn how to write Go. Get ID to do it for you and you handle everything else.
Yeah. Anybody can literally do anything.
Correct.
Tools are available today, right?
100%.
Put in the work.
And here's the thing, 9 to 5, I've never gotten past an interview where they said, "What hours do you work?" And I'm like, 9 to 5. No, look,
Yeah.
I work in IT. I realize that I'm always on call whether I like it or not. I can't be in IT if I'm not on call whether I like it or not.
Yeah.
On vacations, I bring my laptop. I was just in Costa Rica. Guess who had their cell phone on them and was doing some work, like remoting in with my cell phone work
Yeah.
while watching crocodiles in a river. So like,
That is work-life balance right there.
and this happened to be an urgent thing where I couldn't sit. You can always say, "Hey, do you mind if you give me a couple of hours?" Or, "Hey, can I get back to you a little bit later?"
Yeah.
But there are things that it's not fair to ask that, or it's things that there's no other person to do it.
Yeah.
Or, hey, this person pays me money to make sure that this works.
Yeah.
So when they call, I answer. And the whole reason I'm able to afford this vacation is because I have a bunch of people who trust that I will pick up the phone and handle it.
Yeah.
And that's the way I view it. If you want a work life balance, great, take a work life job, but don't expect to be an innovator and a leader in your industry with that type of attitude. And
Yeah.
again, I'm not saying you can't say, "Hey, do you mind giving me an hour?" if it's something really inconvenient or something like that, but go a couple of days without my phone or my laptop. Are you insane? Like, there's no way. So put in the work, do as much as you can. A lot of this stuff is going to be for naught, but it will all be things that will make you a more valuable asset to any team.
Steven, you nailed it. Thanks for your time today.
Thank you, Seth.
Really enjoyed our conversation and hope to stay in touch. And thanks for being on the Innovators Playbook podcast. Really appreciate it.
Thank you for having me.